Treating and managing PTSD symptoms. PTSD is not strictly curable, and the approaches to treating PTSD vary widely. Over the years, we have tried many things. Some good, some not so good. I don't think anything has been a total waste of time, though. When Brian first came home from Afghanistan, the doctors prescribed multiple medications. I don't know if they worked or not. This many years later, I'm leaning towards not. Most medication is not designed to cure anything, particularly mental health concerns. It is meant to manage symptoms, not cure the underlying problem. However, sometimes symptom management is enough to make life better, at least in the short term. The side effects can be troublesome, though. At one point, my husband said that he felt like a patient on chemotherapy. He was literally taking handfuls of drugs. It didn't work well for him, but that doesn't mean that you shouldn't explore the options that are available. Controversial cannabis. This is also a treatment people explore. With marijuana becoming both medically and recreationally legal in many states, it might be a good solution. The anecdotal evidence, meaning the stuff people say from their own experiences, is that it's one of the best solutions. Again, I'm not a doctor, and I'm not suggesting anyone should partake in a substance that could get them fired or in legal trouble. Just throwing it out there. CBD, in all its form, is also showing promise. It provides all the positive chemical properties of marijuana without the buzz or high. It's more widely available and becoming increasingly socially acceptable. It has been shown to have a positive effect on anxiety disorders, depression, and chronic pain. Eye movement desensitization reprocessing therapy, or EMDR, is a somewhat cutting-edge therapy. EMDR is a unique, non-traditional form of psychotherapy designed to diminish negative feelings associated with memories of traumatic events. Unlike most forms of talk therapy, EMDR focuses less on the traumatic event itself and more on the disturbing emotions and symptoms that result from the event. Treatment includes a hand motion technique used by the therapist to guide the client's eye movements from side to side. It's similar to watching a pendulum swing. EMDR is a controversial intervention because it is unclear exactly how it works. Some psychologists claim it doesn't work. My husband has tried it, and it did work for a while. The first 24 hours after the therapy session were brutal, but then he was better for a while. Some therapists claim that it needs to be administered through multiple sessions to be effective. Others say you need to work in a single session until all negative feelings have been dealt with. At the end of the day, I think it shows promise, but I would choose the practitioner carefully and weigh the pluses and minuses before jumping in. I don't fully endorse or discredit it. Definitely do your research. Cognitive behavioral therapy, sometimes simply called talk therapy, is probably one of the most well-known treatment options for PTSD. This requires a lot of trust and comfort on the part of the patient, but it can be very effective. It's probably a good idea for everyone in the family to have some sort of outlet to dump negative feelings. Talk therapy is a great way to do that. It can be difficult to financially afford treatment. We will discuss finances in more detail below, but one great federal program is the Employee Assistance Program, or EAP program. Employers of a certain size are required to have an EAP program. An EAP program is a voluntary, work-based program that offers free and confidential assessments, short-term counseling, referrals, and follow-up services to employees who have personal and/or work-related problems. EAPs address a broad and complex body of issues affecting mental health and emotional well-being, such as alcohol and other substance abuse, stress, grief, family problems, and psychological disorders. EAP counselors also work in a consultative role with work managers and supervisors to address employee and organizational challenges and needs. Many EAPs are active in helping organizations prevent and cope with workplace violence, trauma, and other emergency response situations. This program allows you to see community mental health providers for free. The number of visits is limited, but it's a great way to get some help and potentially start a relationship with someone in the community who can assist your family. Be sure you understand the details regarding payment for scheduling appointments. Surprises are bad in this case. avoid them. Exercise, meditation, and yoga have also been shown to improve both physical and mental health. As stated in Psychology Today, yoga and other mind-body practices are used to treat PTSD in both civilian and military populations. A literature review of studies on mind-body practices used to treat PTSD found that many approaches in current use reduce the severity of core PTSD symptoms, including intrusive memories, avoidance, and emotional arousal. Individuals who regularly engage in mind-body practices reported improvements in mental health problems frequently associated with PTSD, including anxiety, depression, and anger. This results in improved coping with stress. Another huge factor for managing symptoms and becoming better is having a clear sense of purpose. Maybe that means helping other people, volunteering, or some other thing that focuses the brain and makes it worth getting up every day. Having a clear sense of purpose also improves self-esteem and is likely to increase social interactions. Having a sense of purpose has been critical for improving my husband's PTSD symptoms. This is not a comprehensive list of therapies. New treatments continue to be explored and brought to light every day. It will be interesting to see what the future holds. Next, let's talk about co-occurring disorders, those fun little things that may ride along with PTSD to make life even harder. See you in the next video.